A very good morning to all of you present here. I am Dr. Priya, and today I'll be talking about alveolar bone. Now we know that alveolar bone is a part of periodontium, okay? So the periodontium consists of alveolar bone, the cementum, the periodontal ligament and the gingiva. So today I'll be talking to you all about alveolar bone under the following headings. So in introduction I'll talk about what is bone and what is alveolar bone. Then we'll talk about its functions, its parts, its composition, its histological structure, the bone formation, resorption, the remodeling, and finally its clinical application. So start with what is bone. Now we know that bone is a mineralized connective tissue. Okay, it is rigid, it is one of the hardest structures of the body and it is highly vascular. So what is alveolar bone? Now alveolar bone is the part of maxilla and the mandible that surrounds and forms the tooth socket. Okay, it forms when the tooth erupts and it resolves when the tooth is lost. Now because it is so dependent on the tooth structure, it is also known as tooth dependent bony structure. The size, shape, location and the function of the teeth will determine the morphology of the alveolar bone. So talking about what are its functions, okay. So alveolar bone has 5 classic functions. The first is it houses the roots of the teeth. Second, it helps to move the teeth for better occlusion. It also supplies vessels to the periodontal ligament. It houses and protects developing permanent teeth while supporting the primary teeth. And finally, it organizes the eruption of the teeth. Moving ahead, so after we spoke about the introduction and the functions, next we'll talk about its composition. Now like any other mineralized structure, now alveolar bone also consists of both organic and inorganic components. Now the organic components consist of both collagen and non-collagenous proteins. Now what is important here is to know what kind of collagen protein is present or what type of collagen is present in the bone. So in bone we have type 1 collagen. Other than that, some non-collagenous proteins like osteocalcin, osteopontin, osteonectin, bone sialoprotein and proteoglycans are also present. Talking about the inorganic constituents are basically the hydroxyapatite crystals. So what are the parts of alveolar bone? Now alveolar bone consists basically of 2 parts, okay? That is the alveolar bone proper and the supporting alveolar bone. So alveolar bone proper. Now this bone which surrounds the tooth, okay, which forms the inner socket of the tooth is the alveolar bone proper. Okay, the supporting alveolar bone is these cortical plates and the spongy bone. Now alveolar bone proper has various other names also, like it is also known as a bundle bone. Now why the name bundle bone? Because bundles of fibers of periodontal ligament are anchored into this. So hence it is known as bundle bone. Now in radiographically when you see, it appears very radio opaque, like it is more radio opaque than the neighboring bone structure. Now that radio opacity is due to presence of thick bone without trabeculations. Now because of this reason it is also known as lamina dura. When you see histologically, you see like a cribriform plate. It is also known as a cribriform plate in the histological structure. It consists of it has many perforations, like many openings that carry branches of interalveolar nerves and vessels into the periodontal ligament. The supporting alveolar bone, as I said, it consists of 2 parts, that is the cortical plate and the supporting and the spongy bone. The cortical plates consist of compact bone and form the outer and inner plates of the alveolar process. So when you see here, the inner layer, that is the alveolar bone proper, and the supporting alveolar, that is the cortical plate, they meet at 0.75 to 1.49 mm below the cemento-enamel junction. So after we talk about the parts of the alveolar bone, you should know how does it appear histologically. So talking about the histology of bone, now osteoid is an unmineralized bone matrix on the surface where active bone formation is taking place. Now all mature bones, okay, that is now osteoid is an immature bone. Now all mature bones have a central medullary cavity and outer compact bone. Now the outer compact bone consists of outer layer, that is the periosteum, and the inner layer which lies this medullary cavity, that is the endosteum. Again, periosteum has two layers, okay? An outer layer which is the fibrous layer and the inner layer which is the cellular layer. After this, what we should know is what is a Haversian system or what is an osteon. So a Haversian system consists of a Haversian canal which consists of blood vessels, lymphatics and nerves. Surrounding this Haversian canal, we have certain concentric lamellae, all of which together form an osteon. Now the bone has many such osteons. Now between these osteons or between these Haversian systems, there are some more lamellae which are known as the interstitial lamellae. That is, the lamellae present between the Haversian systems are the interstitial lamellae. Now surrounding the entire thing, there are again some lamellae which are known as the circumferential lamellae. That is, they are present circumferentially around the entire, around all the Haversian systems. Then the next thing what you should know is there are two kinds of lines which are present in the bone, that is the reversal line and the resting line. Now reversal line is a transition between bone deposition to bone resorption. Okay, it appears, it is scalloped in nature. It appears, it has a scalloped outline. Okay, so that is reversal line. Whereas resting line is the line which are regular in appearance, they are not scalloped, okay, and they represent periods of rest. Like bone formation does not take place continuously, so there will be bone formation, then a period of rest. So that period of rest is represented as a resting line which is not scalloped in nature. So like any other mineralized tissue, bone also has certain cells. So there are three main important cells present in the bone, that is osteoblasts, osteocytes and osteoclasts. So when you talk about cells, first thing you should write when you write in your exam is how are these bone cells synthesized, like from where are they synthesized and what is its function. Okay, so osteoblasts are basically mononucleated cells. Okay, they are synthesized, they are derived from osteoprogenitor cells of mesenchymal origin, and they are responsible for laying down the bone matrix. Then talking about osteocytes, now osteocytes are small cells. Now what happens is osteoblasts will lay down the bone matrix. Now once the osteoblast lays down the bone matrix, some of these osteoblasts, they themselves get embedded within the bone matrix. Now when they get embedded within the bone matrix, they reduce in size. Now they are known as osteocytes. So once they reduce in size and they are known as osteocytes, they have certain processes around the osteocyte which are known as canaliculi. Now these canaliculi are responsible for getting all the nutrients into the cell and also removes the metabolic waste outside, removes the metabolic waste away from the cell. Finally, what are osteoclasts? Now osteoclasts are multinucleated. Unlike the osteoblasts which are mononucleated, osteoclasts are multinucleated and they are giant cells. The main function of osteoclasts is to resorb the bone, whereas osteoblasts will lay down the bone, osteoclasts will resorb the bone. So talking about how bone formation takes place, okay. So the process by which bone formation occurs is known as ossification. Now this ossification begins around 6th or 7th week of embryonic life and it continues throughout the adulthood. Now there are basically two processes by which bone formation occurs, that is intramembranous ossification and next is endochondral ossification. The one thing we have to remember is most parts of maxilla and mandible undergo intramembranous ossification. Only the tip of coronoid and the condylar process undergo endochondral ossification. So how does intramembranous ossification occurs? So basically, as we know, bone is a mineralized connective tissue. So before the mineralization occurs, there is only connective tissue, okay, that is the mesenchymal tissues are present. Now in this mesenchymal tissues, when the blood vessels proliferate into the center of the mesenchymal tissues, some of the mesenchymal cells in the center, they'll differentiate into osteoblasts. Now once they differentiate into osteoblasts will start forming the bone matrix. So initially they'll just form small spicules of mineralized tissue. Okay, now these small spicules will lengthen and enlarge and thicken, and finally the entire mesenchymal tissue will get mineralized and it will form a hardened bone structure. So that is about bone formation. Next, we should know how bone remodeling takes place. Now, see, bone formation cannot occur throughout your life, okay? Otherwise, there'll be like huge bones. So, there is bone remodeling, that is, some places when the bone is being formed, in the same area, in the contralateral part, there'll be resorption occurring. So, this formation, resorption together, everything together is known as bone remodeling. So, there are 4 basic steps in bone remodeling, or the sequence of bone remodeling is as: first is the activation phase. That is, any micro fracture or any alteration in the mechanical loading will activate the bone remodeling process. So what happens is, when there is certain amount of micro fracture or any kind of alteration in mechanical loading, the osteoclast cell, okay, the bone resorbing cells, they get activated, okay. Then comes the resorption phase, where the activated osteoclast cells will start resorbing the bone matrix. Now, once they start resorbing, the bone resorption has occurred, there is a reversal phase. That is, after removal of debris produced during matrix degradation, osteoclasts are replaced by osteoblasts. So, in the reversal phase, what happens is, osteoclasts get replaced by osteoblasts. Finally comes the bone formation phase. In bone formation phase, the osteoblasts which are present, they'll start laying down the bone matrix. So this is how the bone remodeling process occurs. So first is the activation phase, where any microstructure or any microfracture or any alteration mechanical loading will activate the osteoclast cells. Then comes the resorption phase, where the activated osteoclast cells will start resorbing the bone. Then comes the reversal phase, where the osteoclasts are replaced by the osteoblasts. Finally is the formative phase, where the osteoblasts lay down the matrix. Now in Carranza, 10K sequence of bone resorption is given, and we expect you all to write in exam the same sequence. So the sequence of bone resorption according to 10K is as follows. First is the attachment of osteoclast to the mineralized bone. Okay, so first the osteoclast will come and attach to the mineralized bone. Once it attaches to the bone, it forms a sealed environment. That sealed environment, in the sealed environment, the osteoclasts start releasing protons. Now we know that these protons will create an acidic environment, because of which the mineral structure of the bone is lost. Now once the mineral structure of the bone is lost, the organic structure of the bone or the organic components of the bone are exposed. After the organic components of the bone are exposed, there is degradation of these organic matrix to constituent amino acids. So the organic components get broken down into amino acids. Finally, the mineral ions and the amino acids are broken down within the osteoclast. So the sequence is, first is the attachment of osteoclast to the mineralized surface of the bone. Then is the creation of sealed acidic environment through the action of proton pump, which demineralizes bone and exposes the organic bone, followed by degradation of the exposed organic matrix to its constituents amino acids via the action of released enzymes. Finally is the sequestering of the mineral ions and amino acids within the osteoclast. So this is a picture. So the osteoclast comes and attaches to the bone. Once it attaches to the bone, it forms a sealed environment here. Okay. Once it forms a sealed environment, it releases protons, causing resorption or degradation of the mineralized ions. Once the mineral content of the bone is resolved, the organic constituents are exposed. Finally, the organic constituents are also broken down. So all this what I was talking was how the alveolar bone is present, or how it looks, or how is it structured in health. Now what happens when there is disease? So next we are going to talk about alveolar bone in disease. So there are certain conditions which would cause alveolar bone loss, like there will be bone loss as we know. So few of the conditions causing alveolar bone loss are extension of gingival inflammation, trauma from occlusion, and certain systemic factors also would cause alveolar bone loss. Some other factors such as periodontitis, periodontal abscess, food impaction, overhanging restoration, and ill-fitting processes would also cause bone loss. So once the bone loss has occurred, we should know that all the bone losses they don't look alike. So there are different patterns of bone loss. So the various patterns of bone loss, I would be talking about that now. So first is horizontal bone loss. Okay, now this horizontal bone loss is the most common type of bone loss you see. what happens in horizontal bone loss is the margin of the bone, okay, the bone margin is reduced in height and it is perpendicular to the tooth, okay. So it is horizontal and perpendicular to the tooth. That is horizontal bone loss, the most common type of bone loss. Next is the vertical bone loss. In vertical bone loss, we see that the base of the defect is apical to the neighboring bone. Like you can see an angular kind of an appearance. That is because the base of the defect is apical to the margins of the bone. That is angular bone loss. Now this vertical or angular bone loss is again classified by Goldman and Cohen into three types. They can be 3-wall defects, 2-wall defects or 1-wall defect. Now 3-wall defects means 3 walls are present and one wall is lost. Okay. 2-wall defects means 2 walls are present, 1 wall is lost. 1-wall defect is only 1 wall is present and the rest of the walls of the bone are lost. Next, talking about reversal of architecture. Now generally the architecture is such that the interdental bone is on a higher level compared to the radicular bone. But what happens during periodontal disease is sometimes there might be reversal of architecture. That is, the interdental bone is at a lower level compared to radicular bone. Now that is known as reversal of architecture. Next, talking about craters. Craters are basically a concavity, like a depression. You will see a concavity between the facial and lingual margins of the bone. Bulbous bony contours are these enlarged bony contours. Then ledges are plateau-like bony margins caused by resorption of thick bone. Now when there is a thick bone that is getting resorbed, it will appear like a ledge-like appearance. That is, it will have like a plateau-like appearance. Finally, trauma from occlusion, that is when the adaptive capacity of the tissue exceeds the when the occlusal forces exceed the adaptive capacity of the tissue injury results. That is trauma from occlusion. Now during trauma from occlusion also we see alveolar bone loss. Then talking about what are fenestration and dehiscence. Now fenestration is this window kind of bone loss where the marginal bone is intact but the bone over here is lost. Whereas dehiscence is a kind of bone loss where the marginal bone is also lost. So various systemic factors causing bone loss are vitamin D deficiency, diabetes, hyperparathyroidism, Paget's disease, fibrous dysplasia, osteoporosis and osteopetrosis. So when a person comes with bone loss, you should always ask for any systemic illness if the patient is having, because it can also be that the patient is having one of these, is suffering from one of these diseases or conditions, and that is why the patient is having bone loss. So finally I would conclude. So bone is a rigid specialized connective tissue. Its formation and function is dependent on the dentition. It is of utmost importance for the health of the periodontium. Thank you.